Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. August is National Overdose Awareness Month, a time to remember those lost to overdose, provide space for grief, connection, and healing, and highlight the work happening in our communities to prevent overdose and support recovery. Throughout the month, we're featuring organizations across our community that work to prevent overdose, support recovery, reduce stigma, and connect people with care. Today, we're learning more about the CSU Prevention Research Center with their executive director, Nate Riggs. Nate, thank you so much for joining us.
Yeah, thank you for having me.
To start, can you just tell us a bit about what the CSU Prevention Research Center is and the work that you do?
Yeah. So the CSU Prevention Research Center is a research center that spans the College of Health and Human Sciences. And what we really try to do is we try to prevent negative health behaviors from happening before they even occur. So we do that by trying to promote the good. And so a lot of our work involves working with community partners around the state of Colorado. We work a lot with county public health departments. We work with school districts and other agencies that are interested in promoting health and well-being across the lifespan.
How did the CSU Prevention Research Center come about?
The CSU Prevention Research Center started in 2014 with some support from the College of Health and Human Sciences, as well as the Department of Human Development and Family Studies. And I started as the executive director in 2019. It's a cross-college initiative to engage our community partners throughout the state of Colorado to promote health and well-being.
What sorts of things do you research at the center?
So we research how we can implement approaches to promoting positive youth development so that young people don't initiate substance use, violence, or other risky behaviors.
Can you expand on the work that the research center does around substance use?
Yeah, so in addition to testing new innovative approaches to preventing substance misuse, at this CSU Prevention Research Center, we are a part of a land-grant university. And as a part of the land-grant university, we have a mission to directly reach out and engage with our community partners, to work alongside those community partners in identifying evidence-based programs that are going to work the best in their own community's unique context and culture. So we'll work with community partners on identifying what programs will work best for them. We work with them on how to implement those programs effectively so that those programs will actually work when they're implemented in the real world. We also work with those communities in evaluation of those evidence-based approaches and thinking about really how do we sustain these approaches to substance misuse over the long term.
So regarding your work with youth and through school partnerships to prevent substance use disorder among middle schoolers and high schooler students, what does that participation look like? I'm trying to imagine what that partnership actually looks like when you guys walk into the schools.
Yeah, when we walk into schools, we recognize that not everybody has been formally trained in the field of prevention science. So prevention is a relatively young scientific field. And as a result, there aren't a ton of practitioners who have been formally trained in how to prevent substance misuse. We first get a sense of what schools are doing well already and identifying where there might be some gaps in the approach to preventing substance misuse. And then we'll sit down and we'll work with those schools and those school districts on identifying which approaches are going to work best in their schools. We'll connect with program developers, so developers of these substance misuse prevention programs, and we'll connect those program developers with schools and school districts and identify how we can implement these programs so that they'll have maximal impact. Then once we start implementing those programs in those schools, we are a source of technical assistance and technical support when questions invariably arise when it comes to implementing these programs so that we can help support that implementation to ensure that these programs that have been tested efficacious in the lab are actually being effective when implemented in the real world. We also have online prevention training modules that can actually be really fun. We can walk practitioners through courses related to things like program evaluation, implementation fidelity, so how to implement programs the right way so that they'll be more likely to have their intended impact. And then we also have things like guidebooks and all sorts of research to practice tools that practitioners can take advantage of. We also will travel throughout the state and provide trainings in person to networks of practitioners. So we've given trainings in Otero County for networks of prevention practitioners who are implementing programs through the opioid settlement funds. Or we've gone to El Paso County and provided a training to a network of educators who are implementing prevention programs. So, we can also do those things and roll up our sleeves a little bit more and dig a little bit deeper and a little bit more of a personal connection with folks in that training. I think that there are opportunities in Colorado and around the country to create more robust prevention infrastructure to support prevention practitioners. And as part of that infrastructure, more training programs for prevention practice. And I think that Colorado State University is a perfect place for those types of programs because of its land-grant university, because part of our mission is to train that next generation of the workforce that is going out into the community and actually doing the good work of prevention.
How does the approach that you bring to this partnership kind of differ with age groups? Because that's quite a wide gambit, and I'm sure that, myself as a former cynical teenager might be less receptive to some messaging than somebody who's much younger and more optimistic.
Yeah, right. So we at the Prevention Research Center, we work really far upstream. So we're trying to prevent this substance use before young people even start that first drink or that first onset of nicotine use, right? And so we work as far upstream as elementary school.
Oh, wow.
But we're not talking about drugs with kindergartners, right? What we're doing with kindergartners through sixth graders really is what we're trying to do is to promote positive youth development skills, those skills that are going to protect those young people from the onset of substance use. So things like self-regulation, good communication skills, healthy relationships, all of these things that we know are going to protect kids from starting to use substances and then progressing to a substance use disorder. So that's what it looks like in elementary school. Then in middle school, we definitely do that still, but we also layer on some substance use education, some resistance skills, some things that are directly related to, not using substances.
Have you guys had a pretty good success record?
Yeah, we find that the success of these programs really is enhanced when you have a source of training and technical assistance like the CSU Prevention Research Center, because these programs oftentimes have been tested in communities or in schools that aren't identical to the schools that we're working with. And so when we can work with those schools, when we can work with those community partners and answer any kind of questions that they may have as they're implementing these programs, we are finding that when we evaluate the impact of these programs, we're seeing some really nice, not only what we call statistically significant effects, which is really just kind of a scientific term, doesn't really mean anything to schools and communities, but have real actually community effects.
I'm interested in some of the numbers, hey, every dollar spent on prevention leads to X number of whatever.
Yeah. The Washington State Institute of Public Policy has done cost-benefit analyses on these evidence-based programs. And they range from maybe $1.25 for every dollar spent to thousands of dollars for every dollar spent. And so it just kind of depends on the approach. And communities can go to that registry and use that as one point of data when it comes to making a choice on the programs that they want to implement. For example, there's a very well-known substance misuse prevention program that's implemented in middle schools. It's called the Botvin Life Skills Training Program. For every dollar that is spent on that program, there's a return of about $14. And again, it's definitely not in that don't just say no kind of,
the
messaging that
approach,
we know doesn't work.
Right.
And in fact, not only do we know that it doesn't work, we also know that that can actually cause harm. Those kind of messages, they can have what we call, and it's another fancy scientific name, what we call iatrogenic effects or negative effects. We can actually increase the likelihood that a young person will use substances if we do prevention the wrong way.
So what does prevention the wrong way look like then? Like if somebody was like, oh, I'm going to try this, and it was like the absolute worst thing that you could possibly do, what does that look like?
Sometimes we can make substances seem kind of fun and risky if we approach it the wrong way. And so it's really promoting the good and the skill development and arming young people with the skills to be able to make healthy decisions.
So you mentioned that, this is a relatively new version of a science that you guys are participating in and researching. What have we learned about the developing brain for young people that helps us prevent substance use?
Yeah, I love that question. That's actually one of my areas of research interest, is looking at how the brain develops and how that creates periods of relative vulnerability to using substances. So there are a couple of really important parts of the brain when it comes to substance use and non-use. One of them is what we can refer to as the brain's accelerator, the gas pedal of the brain. It's the reward center of the brain. It's these very primitive areas of the brain when what we generally call the limbic system. And these parts of the brain are very sensitive to rewards. Young people have a very well-developed gas pedal. The thing is that there's also a part of the brain that is generally the brake pedal, the prefrontal cortex of the brain, okay? Now, the prefrontal cortex of the brain is the part of the brain that makes us the most human. We're able to think of consequences. We're able to plan. We're able to regulate our emotions and our impulses. And obviously, very important part of the brain, that part of the brain isn't fully developed until young people are around the age of 25. So between the age of about 11 and the age of 25, young people have a very well-developed gas pedal, but not a fully functional brake pedal, okay? And that window of time opens young people up to vulnerability to using substances, to taking risks, including substances.
When does the brain fully stop developing, or does it not really stop development?
Well, we have the potential to form new thoughts and think in different ways throughout our lifespan, right? But we have periods of relative malleability, relative flexibility in how able the brain is to really modify or change in major ways. And that in the prefrontal cortex of the brain ends at around the age of 25. So that window between the ages of 11 or 12 and 25, it is a period of relative vulnerability, but it's also a window where we can implement our preventive interventions to really work with kids and help be able to form the connections that we want them to connect in the brain, right? And make the right decisions when it comes to substances.
So I'm also curious about where these preventative measures might show up in other parts of their life. Is that also through parenting, or I'm assuming most of it probably is school programs from what you've mentioned, but I'm kind of curious if there are other venues for that.
Absolutely, yes. So I've been talking about school-based programs for the most part so far. Preventive interventions can be implemented in many important contexts. There are evidence-based preventive interventions that can be implemented in the family context. Many of those programs focus on promoting healthy rulemaking, healthy communication, and really just good parenting skills that can be applied to preventing young people from using substances.
Have you encountered any instances where you bring, hey, this is what we would recommend for your community, and then you've gotten some resistance from the community saying, we're not touching that?
Yeah, yes, I love that question. So yes, we have been talking, or I have been talking a lot about evidence-based programs, and in ideal situations, evidence-based programs are what we recommend. The ideal is, of course, the ideal, and is oftentimes not the case. And so what we communicate to our community partners is that we're not the evidence-based police. We're not only going to work with you if you want to or are going to implement an evidence-based program. What we can also do is if we say, hey, these are the evidence-based models, and you say none of these are going to work, then we will go to the drawing board with you, and we will try to help co-create something with you that is at least research informed, that is based on science, in this case, substance misuse. But we aren't going to force you to implement an evidence-based program if it's not going to work in your community. That's not going to be good for anybody. So, yeah.
Yeah, it sounds like you're really tailoring a lot of these approaches to the communities so that they are effective. I am curious, how does Larimer County kind of stand out? Is there anything that makes Larimer County a little bit different from some of the other organizations or counties that you've worked with?
I think every community, every county is different. A lot of the support that we've had from county public health, as well as the district leadership when it comes to prevention, there's been a lot of buy-in that if we do prevention the right way, we can promote health, we can promote development, we can keep kids from using substances, and in turn save lives moving, down the field. And so, we've had a lot of great conversations with Thompson School District, Poudre School District, and Estes Park School District. And we've done a really good job working with those school districts in layering different approaches to prevention on top of each other so that we can have a really comprehensive impact on the lives of young people attending those schools. It's been one of my favorite projects that I've ever been a part of in my entire career.
Oh, wow.
We talked briefly about what we've learned about DARE and that approach. Can you speak more broadly about how research has influenced the ways that we approach prevention for substance use?
One of the things that's been really interesting about the field of prevention is that it's almost a misnomer. It really has its roots in kind of the CDC model of preventing negative things from happening and preventing all these bad things from happening in life. Really, what it's more about, what we've found is that it can be more effective to really focus on the good, really focus on promoting the good, promoting the skills, promoting things like that we've been talking about, social and emotional learning skills, resistance skills, healthy communication, peer relationships. By promoting the good, you can have a greater impact on preventing the bad later on down the line. The things that we've found that haven't worked in the past are the things that are the just say no to drugs. The focus on the outcome is less effective than focusing on what we call these risk and protective factors.
What does a typical day in the life of someone conducting this type of research look like? What does their sort of 9 to 5 look like?
One of the things that I love about my job is there's not a typical 9 to 5. I mean, some days I'm sitting in front of my computer all day long. I'm writing research grant proposals, or I'm writing a peer-reviewed journal article that's contributing to the science, or I'm analyzing data. I enjoy that part. It's also at the same time probably my least favorite part of my day. The most fun part of my day is working with my team in our conference room, and we call these, whiteboard sessions, where we just sit in front of the whiteboard and we talk about how are we going to engage with our communities and support them in implementing these programs that we know are going to have a positive effect on their lives. And so that's a really fun aspect of my week. Other times, I really enjoy driving down to the San Luis Valley and meeting with community partners and learning about communities and what makes them tick and what can work best in those communities. So it's a combination of what you would think about as maybe a kind of the dry scientific life, but also this really great opportunity to really engage with communities. And that's one of the reasons why I really enjoy working at Colorado State University, is that we have this land grant mission where engaging with community partners and translating science to better communities is valued as much as the next publication or the next grant proposal, or those types of things. And then I also get to teach, and I'm teaching our graduate seminar in prevention science across the lifespan. Starts in 2 weeks, and I'm just super excited to do that as well for our graduate students.
I'm curious then, who kind of makes up the CSU Prevention Research Center? Does teaching end up becoming a pipeline to to staff the research center, or what does that look like?
It's funny that you mentioned that. Yeah. So one of the things that I wanted to do when I became the director at the Prevention Research Center was to form divisions. And so we have 3 divisions at the Prevention Research Center. One is the Healthy Schools Division, and a lot of the work that I've been talking about so far falls under that division. We also have a Healthy Aging Division where we work with individuals on the other end of the lifespan to promote optimal aging. We have a division called the Intellectual and Developmental Disabilities Division. So we work with children and their families who have an intellectual or developmental disability. And then we have a Community University Partnerships Division, which really is the foundation of everything that we do, engaging our community partners. And so we have faculty who direct each of those divisions. And then we have staff. We have an amazing staff. I can't speak highly enough about our staff. We have implementation specialists who are oftentimes project managers who really are the ones who are interfacing with our community partners the most. And whenever I meet with Larimer County's Opioid Abatement Council, they're always talking about how great our staff are. We have some evaluation specialists as well who are really just great empirical evaluators. And the interesting thing about those folks is that almost all of them come from our Prevention Science Master's program. So I have the great fortune to teach these students who then become graduate research assistants at the Prevention Research Center, and then nobody wants to leave. So, and I don't want them to leave, so I get to hire them, and then they do great work in the community. And so that's great. And then we also have students who work at the Prevention Research Center and gain hands-on prevention science and prevention practice experience that they can then take into their communities once they graduate, or they can take into their first academic positions if they go into academia.
What brought you to this work?
Well, I always knew that I wanted my career to make an impact. I always wanted to be in a profession where I would be able to promote health and well-being. I was a psychology major at the University of Washington, and I thought that if I was going to be a psychology major and I wanted to have an impact, I had to be a clinical psychologist. Right? And I would have been terrible at being a clinical psychologist. I just know that I would have. And luckily, I had an advisor who became a lifelong mentor, one of the first-generation prevention scientists at the University of Washington. His name was Mark Greenberg. And he said, Nate, I know you're applying to all these clinical psychology programs, and I am going to be moving to Penn State University next year, and I'm going to start something called a Prevention Research Center, where we're going to be able to start researching how to prevent these things from happening in the first place. And I thought, wow, that's a novel idea. Yeah, that sounds like a great idea. And I thought, well, Pennsylvania, central Pennsylvania. Do I want to move from Seattle to central Pennsylvania? And luckily, it was the best decision I ever made. I consider myself kind of a community guy. I get to have a job where I get to interface, I get to interact, I get to engage with community members almost on a daily basis, in addition to the science. And so, yeah, I think that's kind of a 30,000-foot view of kind of what drew me into this field. I enjoy it so much.
Are there any current research projects that the Research Center is doing that you're particularly excited about?
Yeah, so, I've been talking a little bit about the opioid settlement funds, and I don't know how familiar your audience is with the opioid settlement funds, but we have been working with 4 of Colorado's 19 opioid settlement regions. And this all started in Larimer County. And it has just been, like I said, one of my most favorite projects that I have ever worked on in my entire career. We've been working with Larimer County's Abatement Council for the past 4 years. And we started off, like I said, just really getting to know the 3 school districts in Larimer County. And first, the good stuff that they were doing, and then where there might have been some gaps in their approach. And we collectively got together and identified evidence-based prevention programs that we felt would work in their communities and implemented them, evaluated them, and we're finding that we're really having a positive impact on preventing depression, on preventing anxiety, on preventing substance misuse, on promoting coping skills and resilience. And it's just been really great to to work with the school districts over these past 4 years and develop these relationships where we can have this great communication that really breeds great collaboration and success in the projects that we're working on. And so it's been great. These settlement dollars are going to be around for another, I think, 13 years, and hopefully we'll be able to continue this partnership, hopefully after I retire. So yeah, it's been fun.
We just briefly in a previous episode touched on the most recent Healthy Kids Colorado data that came out and also showed improvements in youth mental health. And so I was just curious. I mean, it's a large ecosystem all working together, but I guess if the CSU Prevention Research Center uses that data at all or interacts with that in any capacity.
The Healthy Kids Colorado survey is a wonderful resource that we can use to identify what are the community-specific needs, risk factors, and protective factors that we can then identify evidence-based prevention programs that can address those specific needs. So that's the first way that we use those data. It's challenging. You're right. When you say that those data are a part of a larger ecosystem, one of the great things about universal prevention programs are these are programs that can be implemented in entire schools or entire school districts. Potentially, those types of programs can have impacts on those population level data. And so we haven't had a chance to take a look at whether the work that we're doing in Larimer County has had an impact on the Healthy Kids Colorado survey data. But it definitely is going to be something that we'll be able to look at, especially if this partnership is sustained over several years. We can look at multiple waves of the Healthy Kids Colorado survey and see if we're having an impact.
So we've interviewed a few organizations, and they've talked about stigma and how it shows up in substance use and how that is one of the barriers that they're always trying to overcome to help better address, just substance use in communities. How does stigma show up in the research and the prevention work that you've done?
One of the great things about prevention is that, especially universal prevention, is that everybody gets the same program. And so young people aren't picked out of class, for example, to go to XYZ program that invariably people in the school ecosystem know that kid's being pulled out to go to the program for this thing. So when it comes to universal prevention programs, if everybody in a classroom is getting the skill building curriculum, then nobody really knows who the kid is that is at relative risk or the kid who has maybe already initiated substance use because everybody's getting the same thing.
If there is a superintendent or organization leader or anyone listening that would like to learn more or maybe get involved with CSU Prevention Research Center's work, where can they go?
Well, you can go to the Prevention Research Center's website, chhs.prevention.colostate.edu, I think, probably something like that, or you can just Google it. Or you can email me at nathaniel.riggs@colostate.edu. I do spend a lot of time in front of my computer. If you email me, you'll probably get an email disturbingly quickly. And I'm always very excited and happy to just talk prevention. I love my job. I love to do the work that I do. And I love working with community partners. And so, yeah, if you're a school superintendent or a principal, or if you're some other community member who is interested in learning more about prevention or partnering with the Prevention Research Center, feel free to reach out. We're always here to support Coloradans across the state.
So what is something about substance use, or I guess in your case, prevention, that you would like our listeners to know more of?
One of the things that I think it's really important to impress upon the listeners is that prevention isn't just something that's nice to have. What we've found over the past 25 years of prevention science is that prevention is the most cost-effective way to make a dent in the substance misuse challenge. And it's also a way to save lives. So one of the best ways to save lives when it comes to substance misuse is to keep people from using substances in the first place anyway, right? And so So not only is prevention nice to promote all these positive youth development skills, it's also a cost-effective way to save lives.
Nate, thank you so much for joining us today.
Yeah, thank you very much. I enjoyed it.
You can find links to learn more about the topics we discussed today in the show notes. If you have a question about public health in Larimer County or a topic you'd like us to discuss, let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next week, stay well, stay connected, and remember, we really are healthier together.